Hello everyone, I am your Ayurveda expert. Today we will talk about the most important topic of Ayurveda, or the very basic topic which we all will study during our study, that is body tissues, which is known as Dhatus as per Ayurveda. So Dhatus or body tissues are the one which supports the body, and they will perform their normal functioning if they are in balance. If these body tissues will get vitiated or depleted, then it will lead to various health concerns. So in this lecture, in this presentation, we will talk about the body tissues, their number, what are their normal functions, and what will happen if they will get depleted or vitiated, and how we can manage these vitiations and depletions. So let's talk about these body tissues in detail. So coming to the first slide, that is the introduction. So body tissues are the one which supports the body, which nourishes the body. Okay, because they does dharan of the body. Dharan is an Hindi word which means basically which supports the body. Dharan means which supports or nourishes. So that's what it is written. Dhatu provides supports and nutrition and responsible for the origin, sustenance and destruction of the body. So as we have talked, like if these body tissues will be in balance, they will not lead to any kind of illnesses. But if they are vitiated or depleted, then it will lead to various kind of health concerns. Okay, so coming to the next slide. So these body tissues are 7 in number. So the first one is Ras Dhatu, which means circulatory fluids. The second one is Rakt Dhatu, which means blood tissue. The third one is Mas Dhatu, which means the muscle tissue. The fourth one is Med Dhatu, which means the adipose tissue. The fifth one is the Asthi Dhatu, that is the bony tissue. The sixth one is the bone marrow, that is Majja Dhatu. And the last or the seventh one is the reproductive tissue, which is known as the Shukra Dhatu. So we will talk about all these body tissues in detail. So coming to the next slide. So when we take the food, our food get metabolized, then it will form as a nutritive part, or the aharas. Aharas is the nutritive part of the food. So after the metabolization, this aharas or the metabolized food is formed. And when this is formed, it will lead to the formation of the first body tissue, that is Ras Dhatu or the circulatory fluids. So when this Ras Dhatu is formed, then it will lead to the formation of all the succeeding body tissues, because Ras Dhatu is the first body tissue which is getting formed after the metabolization of the food. Okay, so for the formation of first body tissue, the aharas or the nutritive part of the food is necessary, and for the formation of succeeding body tissues, the proper formation of Ras Dhatu is necessary. So we will see how these body tissues are getting formed successively, and how we can correlate them in modern. So the first one is formation of Rakt from Rasa. So from the circulatory fluids, how the blood tissue is getting formed. So firstly, we'll talk about the Ayurveda view. So Ras Dhatu basically nourishes the Rakt Dhatu. So in Ayurveda, it has been said, when the Ras is formed with the help of Ranjak Pitta. Ranjak Pitta is basically a type of Pitta dosha, and it will help in formation. Basically, the function of Ranjak Pitta is to provide color to the blood. So basically, with the help of Ranjak Pitta, which resides in the liver, it forms the Ras Dhatu to Rakt Dhatu. So it converts the circulatory fluids to blood tissue. Okay, and it gets nourishment from the Ras Dhatu. So how we can correlate them in modern? So the nutrients absorbed from the blood, that is the plasma, Ras, which is circulatory fluid, supports the hematopoiesis, the formation of red blood cells in the bone marrow. So how accurate is the nutrients? It will lead to the formation of the next body tissue, that is Rakta Dhatu. And as per the Ayurveda, with the help of Ranjak Pitta, the pith which resides in the liver, and its function is to provide the color, so it helps in conversion of Ras Dhatu to the blood tissue, which is Rakta Dhatu. So that's how the Ras gets converted into Rakt. Coming to the next slide, formation of Mams from Rakta. As per Ayurveda, Rakta Dhatu, the blood tissue, basically nourishes the muscle tissue. Okay, and as per modern view, the oxygen and the amino acid. So basically, Rakt is the blood. So blood carries oxygen. So the oxygen and the amino acids in blood essential for the muscle cell repair, growth, and metabolism. Right? So it is very necessary for the formation of muscle tissue. Okay, so that's how the Rakt Dhatu get converted into the Mas Dhatu. Okay, so coming to the next slide, that is the formation of Med from the Mams Dhatu. So as per Ayurveda, the previous Dhatu, that is the Mams Dhatu, give rise to Med, that is the adipose tissue. And as per modern, when these muscles, the muscle energy are low, the muscle energy needs are low, the excess glucose and the fat are stored as the adipose tissue. Okay, so if your muscle tissue doesn't need the excess glucose or fat, then it gets stored as the adipose tissue. So that's how as per modern, the muscle tissue gets converted into the adipose tissue. Okay, so coming to the next slide, that is the formation of Asthi Dhatu from Med. As per Ayurveda, the Med Dhatu nourishes the Asthi Dhatu. As per modern, fat helps in bone health, right? Because it helps in storage and conversion of vitamin D, essential for calcium absorption, right? So we all know for the absorption of calcium, we need vitamin D, right? And the people who are suffering from calcium deficiency, they always have vitamin D deficiency also, right? So for the metabolization or the absorption of calcium, we need vitamin D, right? And energy reserves from fat helps in the osteoblast activity, so formation of bone cells, right? So the adipose tissue which get stored as the energy reserve, they are helping in the formation of the osteoblast, which are the bone cells. Okay, so that's how the Asthi Dhatu is getting formed from the adipose tissue. Coming to the next slide, the formation of Majja Dhatu from Asthi Dhatu, because after bony tissue, the next tissue which is to be formed is the Majja Dhatu. So as per Ayurveda, the bony tissue nourishes the succeeding body tissue, that is Majja. And as per modern, the bones are the house of the bone marrow, right? Because as you can see in the image, it's very beautifully explained. So in the bone, there is bone marrow. So as the bone matures, marrow space develops inside the bones, right? So when the bone is getting matured, after the formation of bones, then there is formation of the bone marrow spaces and the formation of cells. Coming to the next slide, formation of Shukra Dhatu from the Majja Dhatu. So the next tissue which is to be formed is the reproductive tissue, which is Shukra Dhatu. So as per Ayurveda, the previous tissue, which is the bone marrow tissue, is basically nourishes the reproductive tissue. As per modern, brain majja governs hormonal signaling via hypothalamus pituitary gonadal axis, leading to formation of reproductive hormones, right? Basically, it stimulates the hypothalamus pituitary because the hypothalamus send signals to the pituitary gland to secrete the reproductive hormones, which is necessary for the formation of you know uh, reproductive tissue. So that's how the majja tissue, majja dhatu, the bone marrow tissue, helps in formation of the reproductive tissue, and any imbalance in these hormones disturb the fertility or reproductive tissue, right? So that's how all the body tissues are getting formed from the previous body tissues. Okay. Now coming to the next slide. So before starting the Ras Dhatu, the circulatory fluids, I would like to tell you one thing. These body tissues, as per Ayurveda, all the body tissues are getting formed from the previous body tissue. Okay. And when a tissue is getting formed or matured, then it divides into two parts. That is the nutritive part, and then is the waste part. Okay. And from the nutritive part, the two types, there are further two divisions. One is for the nourishment of the Ras Dhatu. For example, the Ras Dhatu formation is there. So when the Ras Dhatu or the circulatory fluids are getting formed, they gets divided into two parts. The first one is the nutritive part, and the second one is the waste part. So when the nutritive part is formed, because the waste is which is formed after the metabolization or during the formation, but the nutritive part further divides into two parts. The first part is needed for the nourishment of that particular tissue which is getting formed, that is Ras Dhatu, and the second part which is getting formed, which is needed for the formation of the succeeding body tissue. So here all the body tissues are getting are forming the succeeding body tissues with that part, because from the nutritive part two portions are there. One portion is for the nourishment of that particular tissue, and the second portion is for the nourishment of the succeeding body tissue. Okay. So that's how these body tissues gets converted to the succeeding body tissues. Okay. So coming to the first body tissue, so from now we will talk about each body tissue and their management. So the first body tissue is Ras Dhatu, that is circulatory fluids. The site of Ras Dhatu is heart, right? And the elemental composition of Ras Dhatu is water. The quantity of the Ras Dhatu is 9 Anjali. 1 Anjali means the amount of fluid, like this is Anjali, the amount of fluid filled in that particular space is known as 1 Anjali, right? And its quantity is 9 Anjali. And it is like, if I have to measure my Ras Dhatu, then I have to take my hollowed palms, my hands. So it is different for everyone. So the quantity is 9 Anjali, right? And coming to the next slide, the functions of Ras Dhatu, the first body tissue. So it helps in the nourishment of body tissues, as we have studied. It has to nourish the succeeding body tissue. The second thing, it is needed for the growth and support, because this Ras Dhatu, this circulatory fluids are getting formed from the Aharas, right? And the Aharas, the nutritive part of the food contains all the nutrients. And when the first body tissue is getting formed, then it is having all the nutrients which is needed for the growth and the support of the body. Okay. The third one is it boosts the immunity, right? So it helps in boosting the immunity, because it has to form all the body tissues, and it has to, provide nutrition to all the body cells. Okay. And the next function of ras dhatu is to form blood. As we know, it has to form the second body tissue, that is rakt dhatu. Okay. So these are the functions of the ras dhatu. Coming to the next slide, that is the symptoms of vitiation. So if this body tissue is particularly vitiated, then what kind of symptoms you will see in people? The first one is cough, heaviness in the body, excessive sleep, low digestive fire, nausea, vomiting, lethargy, right? So as we have studied, the elemental composition is water. It contains water. So water represents which body dosha? That is kapha. So basically the symptoms you will see is like lethargy, cough, heaviness. So they all represents the kapha. The kapha will be more, right? And the sleep will be more, because there is vitiation of ras dhatu. The kapha will be more. So then you will see these kind of symptoms. You will not feel like working. Your digestion will be low, right? And you will feel persistent coughing with phlegm also. Heaviness in the body will be there, and the sleep will be excessive, right? Coming to the next slide, that is the symptoms of depletion. So if this ras dhatu is depleted, the circulatory fluids gets depleted, what symptoms you will see? So the kapha will be less, feeling of emptiness. So now coming to the next slide, that is symptoms of depletion. So if this ras dhatu or the circulatory fluids gets depleted, then what kind of symptoms you will see? The first one is depletion of the respective tissues, definitely, because ras dhatu has to form all the succeeding tissues, right? Dryness of mouth, because the elemental composition of ras dhatu is water. So if it is depleted, the water content will be less and you will have dryness of mouth. The next is thirst, tiredness, intolerance to sound, feeling of emptiness, heaviness of the body will be there. So these are the symptoms which you will see if the ras dhatu is depleted. Okay. So coming to the next slide, that is the diseases occurred. So diseases which is caused due to the depletion or vitiation of circulatory fluids or ras dhatu is anemia, diarrhea, dyspepsia, muscle cramps, hyperthyroidism, cardiac arrhythmia. So these kind of issues you will see if your ras dhatu is depleted. So anyone who is suffering from these diseases, then definitely the first body tissue, the circulatory fluids are not adequate. Coming to the next slide, that is the treatment. So as per Ayurveda, there is a very beautiful shlok for the management of depletion and vitiation of ras dhatu. So the shloka says, Rasajanam Vikaranam Sarvalanghanam Aushadam. That means intermittent fasting or fasting, Langhan is the line of treatment for diseases caused due to vitiation of circulatory fluids, that is ras dhatu vitiation. So if your ras dhatu is vitiated, then the treatment for all the disorders will be Langhan, that is fasting, because we have seen during the vitiation the kapha is more. So to balance the kapha, we have to do fasting, Langhan, right? So coming to the next slide, let's talk about the treatment in detail. So here we have mentioned the type of treatment for the vitiation and then for the depletion. So diet food during the vitiation of that first body tissue, the diet should be light, warm and digestive food, because kapha is more. right? And the treatment of depletion will be hydrating and nourishing food, because we have seen the water content will be less. If kapha will be less, the dryness will be there, dryness of mouth, excessive thirst will be there. So we have to take hydrating foods and nourishing foods, right? And for vitiation, we have to take light, warm, easily digestible foods, right? We don't have to take too much heavy foods. For example, too much dairy products, we should avoid taking it, because it is not at all good for the management. And for the depletion, we have to take hydrating foods, avoid taking dry foods, right? Coming to the lifestyle, avoid day sleeping and sedentary habits, because already your kapha is more. So if you will sleep in the day, the kapha will be much more than the limit. And if you will follow the sedentary habits, like you will not walk, you will not do any physical activity, you will stay at your place, you will not wake up, you will be lying on the bed, then definitely the kapha will increase. Already it's increased, then it is getting more increased. And for in the depletion, the lifestyle should be, you should take adequate rest, because kapha is less. Avoid overexertion, you should avoid having over physical activity, over exertion. Try to take, try to follow the things which are calming, which take proper rest. Do pranayam, it is good for you. Okay, now coming to the herbs. So herbs taken during the treatment of vitiation is musta, guduchi, right? Because it helps in balancing the kapha dosha. During the depletion, you have to take shatavari, yashti madhu, right? Because they are nourishing. So they will balance or normalize your kapha dosha, because your kapha is less in the depletion, right? Coming to the panchkarma therapies, during the vitiation, you have to do langhan, that is fasting, vaman, that is therapeutic emesis, because for vitiated kapha, the best treatment in panchkarma is vaman, right? And in the depletion, you have to do abhyang, to do oil massage, because kapha is less, and it should be done with sesame or the almond oil. Okay, so this is the line of treatment for diseases caused, in rasa dhatu vitiation or depletion. Okay, coming to the next slide, the second body tissue, Rakt Dhatu, that is blood tissue. The site of Rakt Dhatu is liver and spleen. Elemental composition of Rakt Dhatu is fire and water. And its quantity is 8 Anjali. Amount of liquid fills in one's own hollowed palms. As I told you in the previous body tissue also, like if your own hollowed palms contains fluid in one this, it should be 8 times more, like 8 Anjalis, 8 fluid filled palms. Okay, so in the ras dhatu, the quantity of the ras dhatu is 9 Anjali, and the quantity of rakt dhatu is 8 Anjali. Okay, the site of ras dhatu was heart, and the site of rakt dhatu is liver and spleen. Elemental composition of ras dhatu is water, and elemental composition of rakt dhatu is fire and water. Okay, so coming to the next slide, the functions of the rakt dhatu. Sustains life, because the blood carries oxygen, so that's why it sustains life. Enhances complexion, right? Supports muscles and longevity. So it has to form the next body tissue, muscle tissue, so it helps in supporting that, and promotes longevity, sustains life, and enhances the complexion. Okay, because it has blood has a direct relation with pitta, and pitta has a direct relationship with the skin. So if your blood will be good, your pitta will be good, and if your pitta will be good, then definitely you will have good skin complexion. The luster will be there. Coming to the next slide, that is the symptoms of vitiation. So if the rakt dhatu gets vitiated, that means the pitta, the heat gets vitiated in the body. The symptoms which you will see, that is the burning sensation, redness in skin and the eyes, engorgement of blood vessels, skin conditions like rashes, boils, cellulitis, inflammatory conditions will be there, right? So these kind of symptoms you will see when your Rakta Dhatu, the blood tissue, is vitiated. Coming to the next slide, that is symptoms of depletion. So depletion symptoms are cracks in the skin because pitta is less, so skin complexion, luster will not be there. Your skin, luster basically means your skin is shiny. It looks, lustrous. So pitta is less, the cracks in the skin will be there, cold cravings will be there, roughness of skin will be there, complexion was not there, and craving of sour food. So the food which is sour in nature because it increases, pitta dosha, it will be there. And there is already, depletion of that rakt dhatu, then the sour food cravings will be there, cold cravings will be there, roughness of skin will be there. So these kind of symptoms you will see if your rakt dhatu is depleted. Coming to the next slide, that is diseases occurred. So diseases occur due to imbalance of Rakta Dhatu, that is ITP, autoimmune thrombocytopenia, piles, abscess, leprosy, menorrhagia, hypertension, gouty arthritis, blood cancers can be there. Okay, so all these conditions are caused due to depletion or vitiation of the Rakta Dhatu. Coming to the next slide, that is the management. So as per Ayurveda, it has been mentioned the treatment for blood disorders is as per Rakta Pitta with therapeutic purgation, fasting and bloodletting. Okay, so the treatment for disorders of blood tissue, it could be done with purgation because virechan is the best treatment for expelling out the pitta, excessive pitta. Fasting will be there and bloodletting, that is Rakta Mokshan, will be there. Okay, so these kind of treatments we should adapt, if the Rakta Dhatu is not in balance. Okay, coming to the next slide, that is treatment chart. So the diet for the vitiation of blood tissue is cooling, bitter foods. Okay, so pitta is more, so we have to avoid taking spicy sour food because it will increase more pitta, and we have to take cooling or bitter foods, right? And in the depletion, the diet should be iron rich foods, beets, pomegranate, spinach, so basically which increases pitta, which increases blood. Okay, coming to the lifestyle, during vitiation, if pitta will be more, the person should practice Shitli pranayam, Shitkari pranayam, breathing exercise. Okay, so hissing breath, cooling breath can be practiced. Now coming to the depletion. In depletion, the person should practice grounding yoga, pranayam, okay, to normalize the pitta dosha. Coming to the herbs, herbs during vitiation should be used, that is neem. So as we have talked, the diet should be bitter, so we are also prescribing herbs which are having bitter taste. So neem is bitter, right? So that's why we are prescribing it. Manjishtha will be there because it will purify the blood. The conditions like skin conditions, inflammatory conditions, it can be managed very well with Manjishtha. And coming to the depletion, the herbs during depletion of Rakta Dhatu can be used, that is Moringa, Amalaki, Ambelica officinalis. It balances all the three doshas. Okay, so they are very good to normalize pitta. Now coming to the Panchkarma therapies. Panchkarma therapies include Rakta Mokshan, bloodletting, purgation, that is induced, purgation, and virechan will be there because it is same. In the depletion, the treatment or the panchkarma therapy is anuvasan basti, that is nourishing medicated oil enema. Okay, anuvasan basti is basically the oil enema. It is the medicated oils are used. Okay, and the enema is given, so it can be given. Okay, so the person who is suffering from blood tissue disorders due to their depletion or vitiation, they can practice these dietary lifestyle changes, or they can include these herbs and therapies. Okay, coming to the next slide, the next body tissue, that is mams dhatu, that is muscle tissue. The site is the whole body. Elemental composition is earth element. Quantity is 3 Anjali. Amount of liquid fills in one's on hollowed palm. So Anjali, I think you are way familiar with what is Anjali now. So this is 1 Anjali, and if 2 Anjali, then 2 liquid fills and 3. So quantity of muscle tissue is 3 Anjali. And for Rasa, it's 9 Anjali. For Rakt, it's 8 Anjali. And for this Mas Dhatu, it's 3 Anjali. Okay, coming to the next slide, that is the functions of muscle tissue. So the functions of muscle tissue include, it coats bones, supports joints, aids breathing, enable movement, provides strength, provides structure, nourishes adipose tissue. Okay, so it has lots of functions because the muscle tissue is all over our body. Our body gets covered with the muscle tissue, like this is the muscle, and inside that there is bone. So it coats the bones, supports the joints, enables the movement, because with the help of muscles we are able to move our hand, move our body. So it is also being performed by the muscle tissue. Okay, and moreover, it nourishes the succeeding body tissue, that is adipose tissue. Coming to the next slide, that is the symptoms of vitiation. So if this muscle tissue gets vitiated, then what kind of symptoms you will see? Increased body mass, difficulty in movement, excess musculature over the trunk, hip and throat, heaviness in buttocks, cheeks, arms and thighs. Okay, the muscles will be more. If muscle tissue will be more, the muscles will be more, and you will be heavy. The excess musculature will be there in the trunk, in the hip or the throat region. Okay, and heaviness in the buttock region, cheeks, arms, thighs will be there. Okay, coming to the next slide, that is symptoms of depletion. So if this is depleted, then small and dry legs, painful movement, exhaustion and fatigue will be there, weak muscles and tendons, tiny waist, sunken cheeks. Okay, so you will be thin, right, if your muscle tissue is not good. Coming to the next slide, that is the diseases occurred. So diseases occur due to depletion or vitiation of these body tissues. This body tissue, that is goiter, swelling, tonsillitis, gangrene, wasting disease. Okay, so it will be there. Coming to the next slide, that is treatment. So for the treatment of muscle tissue, it should be done with the purification, that is the panchkarma procedures. With surgery, it can be done by doing the kshar karma, that is utilizing alkalis, and agni karam, that is cauterization. So if overgrowth will be there, then we have to do cauterization, then kshar karam will be there, so we have to remove it. Okay, and coming to the next slide, that is the treatment chart. So for the vitiation, the diet should be light, dry, kapha reducing diet, right? Because the elemental composition of Mas Dhatu is earth, which body energy, which dosha, that is kapha dosha. So the diet will be light, dry and kapha reducing. And if there is depletion of the muscle tissue, then protein rich diet or the nourishing foods will be there, so that there is good formation of the muscles. Second is the lifestyle. Lifestyle includes regular physical activity, avoid day sleeping because kapha will be more. And in the depletion, the abhyang or oleation therapy can be done. Okay. Coming to the herbs, in the vitiation, herbs which can be used are gugul, commiphora mukul, triphala, that is 3 myrobalance, haritaki, vibhitaki, amla. So it can be used, okay, because it has a scraping effect, it reduces or balances the kapha dosha, right? So, and in the depletion, the herbs can be used is for the nourishment, that is safed muesli, which is chlorophytum boryvillum. Ashwagandha can be used, so it is very good to nourishing muscles and for building the muscle strength. Next is the Panchkarma therapies, which can be used. The Lekhan Vasti, fat scraping Vasti, enema can be given. Udvartan, herbal powder massage can be done. Okay, Udvartan is a process in which dry powder massage will be there. Like with the powder, the massage will be there and it will help in scraping the excess fat. And in the depletion, the Brihan Basti can be given, which is nourishing enema, which includes Anuvasan Basti, medicated oil Basti for the nourishment of the muscle tissue. Okay. Coming to the next body tissue or the next slide, that is Med Dhatu. Med Dhatu is the adipose tissue. Its site is kidney, omentum, muscles. Elemental composition is earth, water and fire. Quantity is 2 Anjali. Okay, so as you can see, the quantity of the body tissues is getting depleted. In the Ras Dhatu, it's 9 Anjali. In the Rakta Dhatu, it's 8 Anjali. In the Mas Dhatu, it's 3 Anjali. And in the Med Dhatu, it's the 2 Anjali. Okay. Coming to the next slide, that is the functions. So it acts as an energy reserve, aids in sweat production, provide luster to the skin and hairs, nourishes bones and ligaments, protect organs from pressure and friction. Okay, so fat, adipose tissue is basically a fat. It acts as an energy reserve. Whenever your body needs the energy, the fat will go and definitely help the other body tissues. And it aids in sweat production, okay, and provides luster to the skin or hairs, and also nourishes your bones and ligaments and protects our body, protects our body organs from the pressure and the friction. Okay, coming to the next slide, that is the symptoms of vitiation. The first one is bad body odor, cough and dyspnea, enlargement of flanks, untusedness of body, increased abdominal girth. Okay, so if the adipose tissue will be more, then the body odor will be bad, because there are too much fat in the body, your organs are too heavy. Okay, so enlargement of flank region will be there. Flank region is this region, as you can see in the image also, right? The body will be too unctuous, okay, and the abdominal girth is more. Coming to the next slide, that is symptoms of depletion. If this adipose tissue is depleted, then exhaustion will be there, dryness in the body, craving for fatty foods, thinning of abdomen, cracking sound in the joints, right? So these all symptoms will be there because the adipose tissue is depleted, right? Coming to the next slide, that is the diseases occurred. So diseases occur due to made vitiation or depletion, adipose tissue vitiation or depletion, that is tumor, diabetes, hypertension, sebaceous cyst, cardiovascular diseases. So they all comes under Med Dhatu diseases. Coming to the next slide, that is the treatment. Food and drinks that alleviate vata and reduces kapha and Med Dhatu enema. So basically we have to take foods and drinks which alleviates vata and kapha, okay, and Med Dhatu, basically fat, and enema will with sharp, untussed hot drugs, Okay, therapeutic powder massage are recommended for the management of obesity, right? So these are the conditions and these are the treatment protocols which can be given. So foods which alleviates cough and vata will be there, and enema with sharp unctuous hot drugs will be there. Powder massage can be done. Okay, coming to the next slide, that is the treatment chart. In the diet during vitiation, light low fat kapha pacifying diet can be given. Okay, and treatment of depletion, the diet should include healthy fats like ghee, sesame oil, omega-3 fatty acid. Okay, foods which contains good fatty acids, that should be given. And lifestyle, you should in vitiation, daily vigorous exercise can be done. Okay, and in the depletion, early to bed, avoid stress and ensure regular meals, right? In herbs, triphala can be used. Okay, trikatu can be used. Trikatu basically include sont, that is ginger officinale, marich, that is black pepper, and pipli, that is long pepper. So these can be used, okay, because it helps in opening the channels, it helps in, you know, reducing the obesity. Triphala is also very good, so we can use that. And in treatment of depletion, herbs like ashwagandha, bala, sira cordifolia can be used. So herbs which are nourishing in nature, which nourishes the body, so they has to be used. Panchkarma therapies include dry powder massage, because the person with the, too much adipose tissue, they has bad odor, they have, too much oiliness, smoothness in the body. So if we will do dry powder massage, it will help in balancing it. Okay, and in depletion we should do abhyang, that is oil massage, and swedan, that is steam therapy can be given, because it also helps in burning the excess fat. So coming to the next slide, that is asthi dhatu, which is bony tissue. Site, that is bones. Elemental composition, earth and air. Quantity, 360 bones. Okay, coming to the next slide, that is the functions. So functions of bony tissue is to maintain the posture, protect the vital organs, nourishes the bone marrow, provide structural support, because bones are the one which provide structure to the body, right? Supports the muscles, veins and ligaments, provides, space for the attachment of the muscles. It is also very important. Okay, and it also provides the posture to the body. Okay, coming to the next slide, that is symptoms of vitiation. Bone calcification, extra pointed bone growth, hyperodontia, extra, teeth growth can be there, because if the asthi dhatu will be more, then definitely you have more calcification of bones, extra bone growths, and extra tooth, you have. So these are the symptoms. Coming to the next slide, that is symptoms of depletion. Fatigue, hair loss, joint laxity, joint and bone pain, brittle, breakable nails, weak and loose teeth. Okay, so nails and the teeth are the byproduct of the bone tissue. Okay, so if your bones are good, then you have good hairs, good nails, and good teeth, right? Coming to the next slide, that is the diseases occurred. So diseases occurred includes rickets, fractures, bone tumors, osteoporosis, osteomalacia, osteomyelitis. Okay, so all these conditions are caused due to depletion and vitiation of the bony tissue. Coming to the next slide, that is the treatment. So bony tissue associated disorders should be treated with panchkarma, especially basti, because bony tissue is having which elemental composition, that is vata and kapha. So especially basti prepared with bitter drugs, milk and ghee. Okay, that should be given to balance vata. Coming to the next slide, that is the treatment chart. In diet during vitiation of bony tissue, the light, dry or vata kapha pacifying diet. Okay, so light or easily digestible diet, or diet which basically vata or kapha pacifying, it should be used. Treatment of depletion, calcium rich foods, bone broth, almond milk, dates can be used. Okay, so foods which are rich in calcium, that should be used in the depletion. For example, we can take foxnut. Okay, we can take cashew nuts, they are very good. Almond milk can be given, so they are very good. Bone broth is very good, so it can be used during the depletion. Okay, and during the vitiation we should take, light foods. Lifestyle. In vitiation, regular physical activity to maintain the balance, and in depletion, avoid excess physical activity, strain or fasting, because things which will increase vata definitely will lead to depletion of the body bony tissue. Herbs which you can use is dashamul, that is root of 10 herbs. So herbs which you can use, that is dashamul, root of 10 herbs, kanchanar, that is Bohemia variegata, and in the depletion, the herbs like Arjuna, Hardjod, Shalliki, they helps in balancing vata, right? So these herbs can be used. In Panchkarma therapies, in depletion, you can do Brihan Basti, that is strengthening enema with medicated oils. So that can be given. It is very good and it helps in managing the depletion of the bony tissue. So coming to the next slide, or the next body tissue, that is Majja Dhatu, which is bone marrow tissue. The site for bone marrow tissue is bone, brain, spine, nerves. Elemental composition is water. Quantity is 1 Anjali. So coming to the next slide, that is the functions. So it fills bone cavities, lubricates the body and nourishes the reproductive tissue. Okay, so its main function, Majja Dhatu's main function is to fill the bone, lubricates the body and nourishes the succeeding body tissue, that is reproductive tissue. Coming to the next slide, that is the symptoms of vitiation. That is carbuncles, heaviness in eyes, heaviness in the body. Okay, so these kind of symptoms will be seen. Coming to the next slide, that is symptoms of depletion. Dryness, exhaustion, lassitude in eyes, cracking sound in joints, feeling of emptiness, craving for fatty food and meat will be there. Okay, so basically you will feel exhausted, dryness will be there because bone marrow tissue is not proper. Okay, and in the elemental composition we have seen, there is water element in the bone marrow tissue. So that's why the kapha will be there, and in the depletion the kapha will be less, and if kapha will be less, you have dryness, exhaustion, lassitude, etc. Coming to the next slide, that is diseases occurred. Diseases occurred are diabetes, vertigo, urinary tract disorders, seborrheic dermatitis and conjunctivitis, dandruff, etc. So all these conditions, all these diseases are seen due to vitiation and depletion of bone marrow tissue. Coming to the treatment. So as per Ayurveda, bone marrow and reproductive tissue disorders should be treated with diet having sweet and bitter taste, coitus, exercise and timely purification procedures as required. Okay, so the treatment protocol as per Ayurveda for Majja Dhatu and for Shukra Dhatu is same, right? Some of the procedures can be done in bone marrow and some of them in the reproductive tissue disorders. So let's see what kind of treatment we will give. So in the next slide, there is the treatment chart. So in diet, for vitiation, light digestive foods and avoid heavy foods, because there is vitiation of the Majja Dhatu. Then the kapha is more, so we have to avoid giving heavy diets, heavy foods, and we should prefer light and digestible meals. In the depletion, the unctuous and nourishing food should be given. The food basically which nourishes or balances the kapha, that can be given. In the lifestyle, daily exercise, avoid excessive sleep or lethargy. Okay, so that should be practiced. And in the depletion, restful routine, minimal mental and physical exertion should be there. In the herbs, manjishtha, triphala can be used. Okay, and in the depletion, brahmi, ashwagandha can be given. Okay, for the bone marrow. And in vitiation, the herbs like triphala, manjishtha, because they balances all the three doshas, right? And in panchkarma therapies, detoxification procedures, in vitiation, shiro abhyang, head massage with light oils can be given. In depletion, brihan basti, nourishing enema with medicated oils, nasya, medicated nasal drops, so that can be practiced or that can be used, so they are very helpful. Coming to the next slide, that is the shukra dhatu, which is reproductive tissue. Site is whole body. Elemental composition is air, fire, earth and water. Quantity is half Anjali. So now we are talking about the last body tissue, and in the first body tissue the quantity of the fluid is 9 Anjali, and after it reaches the formation of last body tissue is there, the quantity of the dhatu is Ardh Anjali, which is half Anjali, half hollowed palms. Okay, so coming to the next slide, that is the functions. Functions include courage, affection, reproduction, determination, body strength, sexual pleasure. They are governed by the reproductive tissue. Okay, coming to the next slide, that is symptoms of vitiation. Enhanced libido, seminal concretions, premature ejaculation, excessive semen flow will be there. Okay, coming to the next slide, that is symptoms of depletion. So if reproductive tissue is depleted, symptoms like dry mouth, body ache, exhaustion, impotency, difficulty in ejaculation can be there. So coming to the next slide, other symptoms include pain in the testes and penis, difficulty in ejaculation will be there, a burning sensation in the genital parts, painful coitus with low semen output. Okay, coming to the next slide, diseases occurred, infertility, debility will be there, impotency, seminal calculi will be there. So these kind of diseases can be seen. Okay, so in the treatment, as per Ayurveda, as we have talked, in the bone marrow and reproductive tissue will be same, which includes diet having sweet and bitter taste, doing coitus, exercise and timely purification procedures can be done for the management of reproductive tissue. Coming to the next slide, that is the treatment chart. The first one is the diet. In vitiation, light, dry, kapha reducing diet will be there. In depletion, nourishing and unctuous foods. Lifestyle, discipline in sexual habits, avoid laziness and day sleeping. Okay. Treatment of depletion, adequate sleep, mental relaxation, aphrodisiac therapy can be given. Okay, in herbs, triphala can be used because there is vitiation of reproductive tissue. And treatment of depletion includes shilajit, kapikachu, other herbs like ashwagandha, safed musli can be used, so they are very good. Okay, and panchkarma therapies include vaman if kapha is dominant, okay, which is induced emesis, and in depletion, brihan basti or rejuvenating enema will be there. Okay, so this is the basic guideline of the treatment. If the symptoms of this particular tissue is vitiated or depleted, then you should focus on these kind of diet, lifestyle, herbs and therapies. But for the customized treatment, you should consult with Ayurveda expert, so they will provide you the customized diet, lifestyle and herbs. Okay, so coming to the next slide, that is body tissue formation time. So the Ras Dhatu, so now we are talking about in how much time these body tissues are getting formed. Like you have taken the food, okay, after 24 hours to 5 days, the first body tissue is getting formed, which is Ras Dhatu, circulatory fluids. The second body tissue is Rakta Dhatu. It is formed after 10 days. Mams Dhatu, muscle tissue, is getting formed after 11 days. Med Dhatu, adipose tissue, is formed after 15 days. Asthi Dhatu, bony tissue, is getting formed after 20 days. Majja Dhatu, that is bone marrow tissue, is getting formed after 25 days. And Shukra Dhatu, or reproductive tissue, is formed after 1 month. Okay, so this is the formation time of all the body tissues. Like it takes approximate 1 month to nourish or form each body tissue. Like from Rasa to Shukr, the tissues are getting, formed and taking approximate 1 month. So coming to the conclusion, so imbalance in any body tissue leads to diseases which manifest uniquely in the body and the mind, right? Because if there is depletion and vitiation of some particular body tissue, it will definitely affect the body and it will definitely hamper the psychic or the body doshas, right? So, but Ayurveda helps in restoring the balance through diet, lifestyle, herbs, and the therapies, and also helps in nurturing your mind, body, and tissues. So, to keep all your body tissues in balance, it's very, very important. So that's why, you should be aware of this information so that you can analyze if which of your body tissue is depleted and which of your body tissue is vitiated, right? So as we have talked, like what are the symptoms, how we can manage this. So this is the basic guideline which we have guided you. But for the more customized treatment for your health concerns, you will definitely consult with Ayurveda experts. So I hope you have liked this information, and for further details you can be in touch with us or share your queries in the comments. Thank you.